much, ladies and gentlemen. As has been alluded to, we have got quite a packed agenda to get through today. We're going to break down the discussion areas into the following sections. We have health and social care first, so that will cover your GPs, NHS, social services, etc. And then we'll move on to education, and we have a speaker from the Alliance for Inclusive Education, I believe, here to give us a brief introduction first when we get to that section. We will then have transport, and we have Freya from Transport for All to actually introduce that section for us. We will then move on to benefits, and then we'll open the floor for a free-for-all discussion for any remaining time. I would like to get everybody on the panel to have a chance to answer all the questions, so I am going to limit you to 3 minutes per answer for each question so that we can get through as many as possible. Okay. So our first section is health and social care.
Well, I think this is a really big issue, and I was speaking to somebody in East Ham High Street this morning who needs to see their GP and cannot get an appointment. I mean, people say they have to wait a fortnight, have to wait 3 weeks. This guy simply has been unable to get an appointment at all. And this is getting worse and worse and worse. And we are committed to the target that anyone should be able to see their GP within 48 hours. And as you rightly say, that is going to require a big investment in recruiting doctors. So our central proposal on this is that we will introduce a mansion tax on homes that are worth more than £2 million. I suspect probably nobody here has a home worth more than £2 million, but you never know. And that will raise for us £2.5 billion a year, and that will enable us, we think, to recruit an extra 8,000 GPs and also 20,000 doctors in order to deal with some of these pressures. And what we're calling that is our time to care fund, because I think that's the problem at the moment. People in the health service just don't have the time to care. They're run absolutely ragged. And there's got to be better resourcing, and we think the mansion tax is the way to provide it. Samir referred to the fact he was frank enough to admit that the government, having said they were going to eliminate the deficit in this Parliament, of actually bearing hard the deficit. And Samir suggested that was because once they got into office they discovered things weren't what they thought. Well, actually it was after the election. David Cameron, I remember, standing up in Parliament and telling us they were going to eliminate the deficit in this Parliament. Alistair Darling's plan was to halve it, and David Cameron at the time described that as woefully inadequate. But now they're asking us to congratulate them on having halved the deficit, which they described as woefully. Anyway, because of their failure on that, that does mean there are serious constraints ahead. And this week, the Conservatives have said they're going to fund £8 billion for the health service from future growth. Well, of course, future growth was how they were going to pay off the deficit in one Parliament, and sadly that didn't work, so I'm afraid the plan to get the £8 billion for the health service isn't going to work either. No, what's necessary is a clear source of funding, and that is what the mentioned tax will give us, £2.5 billion a year. It will help us to start at least addressing exactly the problems you described.
So, I don't know about you, but I fear for the future of our NHS. I really, really do. I'm worried that most of the major parties will not give it the funding that it desperately needs. Not only that, but they are not supporting the Green MP Caroline Lucas's NHS reinstatement bill. We've been lucky enough to have a handful of Labour MPs support the bill, but the majority of MPs are against this. All that bill would do would be to reverse the marketisation of the NHS, whereby the profit motive is supposed to give us the services that we all need and want. However, what we're seeing is when private companies get hold of hospitals, they realise there's no profit in it. They mess up the hospital and then they hand it back. We need to remove all profit from the NHS. And I think what we're seeing is doctors reacting to this situation where profit is king above the people. And I sympathise with doctors in that. I wouldn't want to meet arbitrary targets working with private companies who care about their shareholders and not the people they're supposed to treat. So the Green Party has a plan to roll back all privatisation of healthcare, which would actually bring in £10 billion, because that is what we are paying in order to have this system of markets within the NHS. That would provide plenty of money towards doctors being paid properly, having decent hours, and nurses. Nurses are so important, and they're being treated shamefully by the managers in the NHS. So what we'd like to do is ensure that the doctors and nurses, that we listen to them, and what they say goes. Not managers, not shareholders, not executive directors of private companies, but the actual health professionals and the patients themselves about what they want to see happen in the NHS. And I'm pretty sure that the majority of people in this country want to see the NHS returned to us, the people, because it's us that get ill, it's us that get stressed, it's us that have mental health problems. And so I'm very proud to support the Green Party in bringing back the dignity and the satisfaction of being a doctor or a nurse or a healthcare support worker in the NHS.
Yeah, it's a very good question. I mean, on the sort of national policy stuff, I'm not going to sort of run off and talk about deficit fiscal thingies. But on the overall NHS spending, as you know, the Liberal Democrats have committed an extra $8 billion for the NHS, hurriedly followed by an unfunded pledge from the Conservative Party on the same thing. But the question is a very good one. How is it that in some parts of London, for example, where I live, you can get an appointment, GP appointment quite easily on the same day, whereas in the place I used to live, in other parts of London, you were lucky to get an appointment within 3 weeks. So there's a sort of, the current system has created a kind of postcode lottery. You're absolutely right about that. But it's up to the politicians, people like myself, to solve the problem rather than pointing the finger at others. And we are, after all, a public service to you. And I think that in order to address the problem, we have to remember, first of all, that GP practices are private businesses. They are part of the NHS system, but they're not legally part of the NHS. And let us not forget that the NHS, the GP service deal, which was probably very poorly negotiated 6 or 7 years ago, has provided really quite extraordinary income from some GPs. I mean, some husband and wife teams around the country are having income of in excess of £250,000 a year. So there was an interesting question: how come, if the GPs are paid such large sums of money, how come there's such a shortage? And part of the difficulty is that the way that GPs are educated and trained into the health system in the UK is highly restricted. And if we don't deal with that problem, we're going to have shortages of GPs, until we're all on our deathbeds. I mean, it's utterly ridiculous. And we have to, from a practical point of view, we have to address the question of the training and education system for medics in this country. Of course, as you know, a large number of GPs, especially in this part of London, come from overseas and were trained overseas and provide a good service. It doesn't get away from the fact that we have a shortage and we have a long waiting list. We have to deal with that problem. So it's the medical system as a whole, the education and training system does make a difference. There's hardly a shortage of cash. Some people are being paid $250,000 a year to be a GP. It's not all paid that amount of money, but you understand the general problem. The other thing I want to mention about this is the difficulty in the distinction between private and public. And we've all experienced it. I've been to hospitals in the UK and I've been to A&E, where you can kind of go downstairs in the same NHS hospital and jump the queue by paying a large sum of money for private care. This happened to me. I was actually a broken limb and had to go to A&E after skating foolishly in the winter. And there was a screen in the A&E waiting room saying, jump the queue and go private. A screen inside the waiting room. I've been waiting there for 6 hours to be seen 2 broken limbs. I mean, as we look at this, the difficulty is that it's very hard to know where the resources are going. Because when I had, for my company, I had medical insurance at one point from a company. I went to the hospital, and then I went downstairs to the private bit and saw the same doctor that I would have seen upstairs. Yes, but he saw me immediately, as opposed to waiting 3 months or 4 months. I mean, we've got to sort these problems out. It's not just a question of how much money one puts into the system, where it does need more money, of course, because of population growth and so on. But there are systemic issues here in the health system that we have to address. And if we don't address them, and if we make the NHS a kind of, kind of political ping pong, what he said, well, we're never going to solve them. We have to deal with the systemic problems as they exist. And they're really not. I mean, the questions of how much GPs are paid and what the contracts are like, really, it's not so much of a sort of ideological argument. It's more a management and professional one. But if we don't sort those problems out, the systemic problems, we're going to have the same problems 40 years from now, notwithstanding all the promises from the politicians.
I'm picking up one of your last points. I'm glad you've talked about not making this a political ping pong, because actually it was only a couple of months ago when Ed Miliband was caught out red-handed trying to politicise, in his own words, the NHS, which to all of us and to people who use the NHS a lot is a disgusting record. And let's be very clear about the reality of what Labour left us with. And it's not just about the situation the NHS was left in. It was about the culture of cover-up, the inability. Doctors and nurses was too scared to actually come out and talk about what was happening. I mean, in the mid-staff crisis, we had patients drinking out of flower vases. Too scared, the nurses and doctors were, to come out and actually, tell the truth of what's going on. So our record is that we've protected the £12.9 billion, which we promised, into the NHS. And when we talk about us saying that, again, we do need to, I'm not going to sit here and paint the rosiest picture ever and say that everything's great. I mean, I was in hospital the other day, I had a car accident, and I'm sure things could be a lot better, and I know things will be a lot better if we put what Simon Stevens has asked for, which is the $8 billion, to get the NHS back on its feet, and if we can implement that, I'm sure we'll be a lot better. But, again, where does the $8 billion come from? The Green Party talk about, their plans. The Green Party are in control in Brighton. They talk about, the biggest issue is the environment. They've got the worst recycling rates in the country. Let's put things into perspective. The mansion tax we're told about using to pay this, well, the mansion tax has been quoted, I think, 3 or 4 times to pay for 3 or 4 different things. What we're saying,
This is answering the question about
which one I'm coming to now, which is about the funding for that. So the reality is that we need the funding. Now, what we've said, and don't forget, it was under Labour that you lost the chance to actually know who your personal GP was, and that's something that we are planning to bring back in. We want you to know who your GP is, because I've got 2 young kids, and I know it's horrible having to ring up and trying to work out. I mean, it's awful. I ring the nursery up and I don't know who the kid's GP is. And what we've pledged, by 2020, having put the money back into the economy, projected on what we've saved and the monies that we've created and saved during this Parliament, everyone over 75 will be guaranteed a GP's appointment on the same day, and between 24 to 48 hours, we're edging towards 24 is our aim, but we want to be very realistic, but within 48 hours, we want people to be able to have an appointment with a named GP. And that's what's needed, because what's going on at the minute, I mean, I sometimes have to wait you ring up with the flu or something, and you have to wait 2 weeks, you're told it's a 2 weeks wait, and if you've got kids, it's not you know, it's just not ideal and it's not possible. One of the things we have done, and one of the things that we do encourage, is multiple GP practices where you have named doctors. There are a number of them there which are open for a number of hours, which then eases the pressure on A&E. But again, again, all this hinges on us having the right amount of money. The 8 billion which we've pledged, we feel will be enough to then make sure that everyone over 75 gets a same-day appointment, and between 24 to 48 hours, every other person with a named GP will be able to get your appointment.